السلام عليكم. أتأكد الصوت بس.
عليكم السلام ورحمة الله وبركاته.
عليكم السلام ورحمة الله.
يا أهلا وسهلا بحضراتكم جميعا. أتمنى أن الصوت يكون واضح، الصوت يكون كويس.
واضح الصوت دكتور خالد.
يا أهلا وسهلا بحضراتكم. How to study for subspecialty examination in endocrinology and diabetes, and of course the European board. Inshallah, today we will discuss how to study and what is the resources and the question banks and how to solve questions and how to have a lot of experience in solving question, because in the real exam there are 200 questions and you have no more time to solve. So try to learn how to solve this question in and actually in every Zoom we must say stay safe for everyone. I hope corona vaccine distributed all over the world and let this virus disappear from our life, and we can meet others face to face, inshallah. Herbert Spencer said, the great aim of education is not knowledge, but the most important, the action. The action we can do. So learning endocrinology is a very important aspect in the medicine, and the knowledge is presented in all over the textbook, but the most important, how to deal with your patient, how to manage your patient, and how to solve the problems. معلش الكلمة دي رايح أقولها بالعربي لأن كلمة الدكتور حمد القاضي a lot of my colleagues asked ايه فايدة ال SCE أو European Board. راح ترجيني في وزارة الصحة ولا لا؟ رايح استفيد منها ايه كشهادة؟ كلمة الدكتور حمد القاضي بدون تفاصيل كتير، شهادة اليوروبيان بورد اند سب سبيشالتي اكزامينيشن اندوكراينولوجي اند دايابيتس، شهادات تتحط في السي في شكلها حلو وتقويه، لكن ما ترقيك في خليج او اي دولة عربية. Of course for everyone specialized in endocrinology in the UK he must have الMRCP and SCE in endocrinology and diabetes. عشان كده هي قيمتها الأساسية بالنسبة لنا في مصر إن راح تخليك تتعلم كويس، راح تخلي مستواك العلمي في الاندوكراينولوجي فوق الرائع. عشان كده هي شهادة بنكتبها في السي في بتاعتنا، بنحطها في العيادات على الروشتات بتاعتنا وهكذا، ولكن وزارة الصحة ستيل في مصر ما بتعترفش بالشهادات. ربما حد من الزملاء، انا بتكلم عن نفسي، انا ما رحتش لوزاره الصحه وقلت لهم انا حاصل على الاس اي واليوروبيان بورد وعايز اترجى بيها او عايز اعمل بيها، انا ما رحتش بصراحه. لو في حد راح لوزاره الصحه وشاف القصه دي ممكن نستفيد منه. على الاقل بالنسبه لي انا الهدف الرئيسي منها اني بتعلم اندوكراين، بتخليني كل يوم بذاكر، ابص على تكست بوك، ابص على جايد لاينز، احل اسئله، وفي النهايه بتحسن مستواي، وده في حد ذاته كفيل انها تستحق الفلوس اللي بتدفع فيها والوقت والمجهود اللي بنستفيده من خلالها. Let's start of course all what you need to pass the exam is Oxford Handbook of Endocrinology and Diabetes. الكتاب ده is very important. The only reference you can hold and study, this is the only book you want. Oxford Handbook of Endocrinology and Diabetes. This is the latest edition, the third edition. Actually, the fourth edition, inshallah, in the following few months will release. And another thing you need to study well is the guidelines, and we will discuss what is the important guidelines needed for the exam. And the most important, solving questions. And this is the most important step to how to solve a question. The tricks in solving a question is very important, because every question has a summit words, highlighted words, red flags. You need to pick it up to solve the question rapidly. And lastly, our YouTube channel, so High Endocrine Group, have a lot of hundred of interactive discussions videos. This is very important, and I will discuss it later, inshallah. Of course, specialty certificate examination in endocrinology and diabetes is held by MRCP, and this is the website. And I will go to the website to learn more about this. This is the MRCP UK website, official website. It is easy to make an account in this website. Of course, previously, in the previous few years, you must pass MRCP, and after that, you have a subspecialty certificate. But from 3 years previously, we can go to the subspecialty without MRCP. So if you want any information, okay, I will answer your question just after this introduction. I will look for the questions, and we can interactive discuss them. So this I will go to specialty. If you want any information about SCE, just go to the mrcpuk.org. And in this is the specialty certificate. For example, if I want to know when the next exam will be held, this is all information about it. This is the places for specialty certificate examination worldwide. Of course, endocrinology and diabetes is held. If you want to know the pass mark, how a pass mark is put in this, because previous is the pass mark from 200 marks, but the last exam, this is changed. And if you want any question to the SCE, need more information about it, you can contact them. But I will go to the exam dates and fees. This is very important to know when the next exam will be held. Of course, this is for 2020, but we want to go to the 2021. The exam for SCE and the European Board will be held at 9th of June 2021. But application must be applied from 17 February to 17 March. And of course, the fees must be sent during this registration period. So for everyone want to go to the next exam, he must apply the form within this time, from the mid of the February to the mid of the March. And of course, the fees can be sent via Visa or a check from the bank and so on. And of course, the results, the exam will be held in 9th of June 2021, and the results will be appeared after 4 weeks after the exam, and the certificate will be posted after 8 weeks after the results release. So for everyone who passed the previous exam, the certificate post will be posted within 8 weeks after the results. And of course, the fees, I will discuss it later, but how to apply this is very easy. Just at the time from mid-February to the mid-March, this is easy. Just to go to the, I will log in from my account, upcoming examination here, and you will find that SCE in endocrinology and diabetes will be put it in as a one option, and you will check for apply at that time. Because I already passed the endocrinology and diabetes, there is no option for endocrinology and diabetes because I already get it. So you will find that endocrinology and diabetes here, and this button is disabled, and at the time of application it will be enabled like this. Just click in it and follow the information. This is very important. Another one, which is European board, this is the same examination as SCE, the same resources, the same questions, and at the same time. So both certificates are to some extent semi-equivalent, but if you have already MRCP in the internal medicine, I prefer SCE for you. If you don't, so go to the European board because the fee is less for the European board. And actually the website is this website, but since a few days this website is not working. When I go to the European board website, I find that the website is not available since a few days. I don't know why. Is it is disabled for logistic problem or not, I don't know, but this is the official website for the European board, and after you choose it, this is the official website. And actually this is the certificate for European board, and this is the certificate for SCE. This is the final certificate for everyone. After passing the exam, they will send certificate like this for the SCE and this for the European board. Congratulations for everyone who passed the latest exam, and I hope everyone who will prepare to the next exam to have the same certificate with a good results. Of course, as I said, both examination are held at the same time, and registration period, the same registration period, so you cannot apply for European board and SCE in the same year, but you can apply for SCE in 1 year and European board for in the next year. الفيز for everyone, of course, ال SCE for international students, this is the fee for SCE, 833 جنيه استرليني، ما اعرفش يعني ايه، ماشي اوكي. But for the European board the fees is 750 euro, and this is less. Of course, for the European board the fees is less. And another one, European Society of Endocrinology give a grant. Actually I take it, and they reduce the fees to the half. So the fees, if you have a grant for European from European Society of Endocrinology, the exam fees will be 375 euro, but this needs apply for at this specific time and specific regulation for the grants from European Society of Endocrinology, and you must be a member of this society to apply for the grant for the European board examination. Let's go to the examination format. Actually, the final exam is computer-based exam. The exam is held in specific centers, which is person view centers available in a lot of countries worldwide. And if you want to know your country have a center or not, so you can go to the exam centers and you will see all the countries which can hold the exam, the final exam. Of course, the exam is computer based, not from your home, but it is in a specific centers which is regulated by European board team and subspecialty team. It is available in the Egypt, in Iraq, in Austria, Bahrain, and of course most of European countries, are Arabic countries, in UK and a lot of countries. So you must, before application, you must choose your examination center you will be held in this. Of course, because COVID in the previous year, the exam is postponed and some centers is not working. So there are a lot of troubles in the previous year exam. Actually, the exam two papers, two computerized papers. Actually, each one is 100 questions. You must solve the question for 100 question within 3 hours. After that, you have only 1 hour break, and after that, you go to the next paper, 100 question within 3 hours. So the exam, you need 7 hours working, 6 hours in the exam and 1 hour in between as a break. So this is a very time solving question. So you need to have a lot of experience how to rapidly solve the questions. And I will discuss it. The composition of each paper contains which of organ or chapter in endocrinology. This is تقريبا طريقة الأسئلة أو عدد الأسئلة في الورق في التو بيبرز. الديابيتس mellitus, diagnose general management, delivery and diabetes care will presented as 28 questions in 2 papers distributed across 2 papers. Diabetic emergencies and the management during acute illness and surgery 12 questions, and complication of diabetes 28 questions. So you have 68 questions from 200. So a diabetes section in the exam represents 34% of the exam. So diabetes is very important portion in the European Board and SCE exam. It represents 34%. The next one is thyroid, which is represented by 36 questions, which equivalent to 18% of the exam. And then the hypothalamus and pituitary questions, 20 questions. The adrenal 20, gonads 20, parathyroid and calcium. In the 2 years previously, parathyroid and calcium represents by 20 questions, but the last one represented by 16 questions only, and other topics will be presented by 20 questions, which include the appetite, the weight, some of genetic questions, and miscellaneous conditions. For example, neuroendocrine tumors and so on, bariatric surgery and so on. This portion include about 20 questions. So the most important to study is diabetes and thyroid. After that, the pituitary, adrenal, gonads, parathyroid, and other topics. So actually, our reference book, which is Oxford Handbook, this is the book Oxford Handbook. You must study most of these portions from the Oxford Handbook. Actually, from now, الhypothalamus and pituitary, الثيرويد, الادرينال, الجونادز, الباراثيرويد is written perfectly in the Oxford Handbook. But the diabetes mellitus is not written as other topics actually. So diabetes, I recommend to study diabetes from the guidelines and also from the Oxford Handbook. But البيتيوتري الثيرويد الادرينال الجوناس الباراثيرويد you did not need any other sources other Oxford Handbook. But in the diabetes mellitus portion, you need to study Oxford Handbook, not alone, but you need at least to study the guidelines a lot of times. And I insist that the American guidelines is not very important in the exam. Both exam are European sources, so you need to study a nice guidelines. For example, the European Thyroid Association guidelines, the European Society of Endocrinology, and also you need to look for the Endocrine Society guidelines, and I will discuss it later, inshallah. A very important interactive videos we do it previously are available in the Sohaj Endocrine group. I put all previous interactive discussions which contains many hundred of interactive discussions for the exam in this group. You just click or search for Suhaj Endocrine group in the YouTube channel, and you will have a treasure of more information and more. I will just thanks a lot of زملاء كتير بعتوا رسائل بالعربي والانجليزي, but I insist to display some of this message sent to me. This is one. انا مش رايح اقول الا الكلمه اللي جالتها لان دي مهمه بالنسبه لي واشكرها كتير على الكلمات الرقيقه. Mainly I was listening to the video while I am cooking or driving or teaching my kids. بالطبع اهديها باقة ورد لان كل المذاكره بتاعتها كانت بتسمع للفيديوهات اللي حاطينها على القناه دي وهي بتطبخ وهي بتشتغل وهي بتسوق وهي بتعلم اطفالها الصغيرين, والحمد لله بفضل الله نجحت وعدت المرحله واستفادت كتير. Another one, this is another one from India, Bombay. He sent to me, I am writing this to you to say thank you so much for your passion to teach others. I studied from your YouTube videos. I actually passed MRCB endocrinology because of you. So I thank you so much from my heart. If you come to Mumbai anytime in the future, please visit my place. And actually, if I travel to Mumbai, I will search for you and meet you. And another one from الدكتورة آلاء said كلام مهم كتير ان اهم طريقة للتعليم هي الفيديوهات, هي التليجرام, هي الواتساب جروب to study well. And lastly, thanks a lot, Dr. Khalid Yusuf. I am most grateful to you for your lecture, your videos, and your hard work. I am really inspired by you. Thank you a lot. I am very, very thankful to you for passing this exam. And I said this mention because this group contains a lot of information. I will go to it. You just go to the YouTube. And search for Suhaj Endocrine group. This one. And if you go to this group, go to the playlist and you will go to the SCE European Board 2020 and you will find a lot of videos which we do it previously. We already discuss Oxford Handbook, all chapters except the gonads chapter, and also we give a lot of of interactive discussion previously with Dr. Mahmoud Izzat, Dr. Sufyan, Dr. Ibrahim, Dr. Anayera, a lot of discussions. For example, we solve all previous exam recall. For example, this one, which is length of this video, for example, is more than 4.5 hours, which is exam 2016 exam recall, and also we give all previous exam and all previous question banks. So this is a treasure for everyone who want to pass the exam. I will go to it, but this group is not my group, actually, not my YouTube channel. A lot of members interact with it and make it alive. Specifically Dr. Mahmoud Izzat, Dr. Ibrahim, Dr. حسام حسني, الدكتور سامح, الدكتور حمد القاضي, الدكتور عبد الرحمن شلبي, الدكتور خلدون, سفيان, علاء, الدكتور مصطفى, والدكتورة نيرة. And actually this work must be sent to Dr. نيرة. بداية القصة في الأساس هي الدكتورة نيرة, مش حد تاني بصراحة. الدكتورة نيرة في فترة من الفترات تقريبا من سنتين ونص عملت زوم ميتنج, أعلنت announce about Zoom meeting with Dr. أتول, and ده كان أذكر يوم جمعة الساعة 1 أو 2 ظهرا, وكنت أنا مسافر. جينا في هذا التوقيت مرتبط بمحاضرة هناك. انتظرنا الدكتور اتول ما جاش، فقلت لهم خلاص بصوا انا ممكن اتكلم شويه ونعمل انتر اكتف ديسكشن. يعني انا ما كناش مرتبين وحد محضر حاجه، فانا شغلت الكمبيوتر بتاعي وشغلت برنامج وبدانا نتكلم مع الدكتوره نيره ومع الزملاء اللي حضروا في القصه دي، فهم اعجبوا بالطريقه وخلاص طب نعمل اجتماعات كل شويه وكده، وبدات الانطلاقه بصراحه بفضل الدكتوره نيره، فشكرا للدكتوره نيره. بالطبع صعب القصه تبقى بهذه الطريقه وبهذه الكثافه الا بالانتر اكتيفيتي. الدكتور محمود عزت والدكتور ابراهيم، الدكتوره روبان، الدكتوره نانسي، الدكتوره ايمان، الدكتوره اسماء، رنا، مجموعه كبيره بصراحه شاركت في المجهود ده. فعشان كده الكلام ده مش بتاعي انا، لا هو بتاع المجموعه كلها وبتاع المجموعه كلها، لان هي اللي شاركت وهي اللي ديسكاست وهي اللي اقترحت حياه معينه وهكذا، فشكرا لهم جميعا. candidate resources, of course, there is a curriculum presented in the website, but and they mentioned that this textbook is important for the exam. Of course, Oxford textbook of endocrinology and diabetes and textbook of diabetes, which and Williams. But actually, the most important is the first one. Don't lose your time. If you prepare for the exam, don't lose your time in the William or Greenspan or Oxford textbook. Just read the Oxford Handbook. This is the only reference you want. And of course, in the website, they mention that there are a lot of journals is very important for the exam, but actually this journals is not very important, except if you have a lot of times to read from it. Of course, European Journal of Endocrinology is very important journal for your clinical practice. If you have a time, read it every time. And this is the official journal for the European Society of Endocrinology. Another one is the Journal of Endocrinology, which is an important journal. And another one, which is the official journal for Endocrine Society, is Journal of Clinical Endocrinology and Metabolism. And actually, the Endocrine Society guidelines are published in this journal. This journal is not very important for the exam. Just go to the guidelines, which I will mention it. This also, the journals is not very important, but in the official website, they recommend to read from it or study from it. Another one, so the most important is Oxford. After that, this guidelines. And actually, because this is a European exam and British exam, you need to study the NICE and Endocrine Society, Society of Endocrinology, European Society of Endocrinology, and European Thyroid Association guidelines, and of course, British Thyroid Association and Joint of British Diabetes Society for inpatient. If you want to pick some of them, okay. I mute some voice. NICE guidelines and LGPDS guidelines is very important. And I will discuss which the guidelines is very important. I will go to the guidelines, the website. I will go to the internet. I will start for the NICE guidelines. This is the link for the NICE guidelines. This is the official website. Go to the NICE guidance. Of course, all guidelines, I collect them, and everyone wants this guidelines as a one file. I can send them to him. But if you want to the updated guidelines, so go to the official website, this one, and you will see, view all the guidance like this. This is all guidelines. If you want to search for one, for example, diabetes, for example, guidelines, so will help this guidelines. Actually, in the NICE guidelines, the most important guidelines for the NICE for diabetes is a type 2 diabetes in adult management, and this is the latest guidelines published in December 2015 and last updated in 2020. And another one is the diabetes in the pregnancy, which is very, very important because there are a lot of difference between these guidelines and American guidelines. Another guidelines for type 1 diabetes, type 1 and type 2 in children and young is not very important. The most important for diabetes is type 2 diabetes in adults and diabetes with pregnancy, in pregnancy. So if you go to the diabetes in pregnancy, you can just download the guidelines as a PDF like this, or you can read it from this website. This is the recommendation. This is a very important guidelines, and actually in the exam, if you want to download the PDF, just click in the PDF and will find these guidelines download to your machine. This is the diabetes in pregnancy guidelines published by the NICE, and actually all guidelines I collect them and I will give you a gift, because we discussed it previously in 5 hours Zoom meeting, discuss all the guidelines needed for the exam. So this is how to go to the guidelines from the NICE. Another important guidelines, for example, if you want to search for another guidelines for hyperpara, for example, this is a recent guidelines, hyperpara, like this. This is a hyperparathyroidism, which is published in the previous year, and you can download these guidelines and read it or print it from your computer and study it well. This is the guidelines published by the NICE. This is very important because you need about 5 or 6 guidelines from the NICE guidelines, which is very important for the exam. The most important one is type 2 diabetes in adults, another one diabetes with pregnancy, another one a risk, cardiovascular risk assessment, and another one is hyperparathyroidism, and hypertension is also very important because it how to manage hypertension specifically in the diabetes. This is a very important guideline. Another guidelines, which is Joint of British Diabetes Society, GBDS. If you don't know how to find this, just search for GBDS guidelines like this. And this is the official Joint of British Diabetes Society website, this one. And he will go to the website. You will find this a very important guidelines, and actually in the exam there are about I think more than of 10 questions from these guidelines. Actually, the most important guidelines published by Joint of British Diabetes Society is DKA and hyperosmolar glycemic state, and another one with glycemic management during the enteral feeding in stroke is very important, and usually in the exam there are 2 or 3 questions from this guideline. And another one, which is management of adults with diabetes undergoing surgery, and another one, of course, DKA and hyperosmolar is I mentioned. Another one is hospital management of hypoglycemia in adults with diabetes, and at least from the hypoglycemia guidelines, 2 questions from this guideline, and you will find that this is the updated guidelines, because in our group we discussed the previous one, which is presented since I think 3 or 4 years. Another guidelines, which is management of adults with diabetes in hemodialysis unit, and another one with management of glycemic control in pregnant women with diabetes on obstetric ward and delivery unit. And if you click for these guidelines or take it from here, I just click, it will be downloaded to your computer and read it or print it or highlight. This is a very important guidelines, because in the exam a lot of questions from this guidelines. So you must pick this important guidelines and at least 5 or 6 from this guideline. Another very important guideline website is European Society of Endocrinology guidelines. If you don't know how to search for it, just go to this website, ESC hormones. This is the official website for the European Society of Endocrinology, and go to the publication, and after that go to the guidelines. Actually, this is all guidelines published by the European Society of Endocrinology, and the most important from these guidelines is 2 guidelines actually. One of them is adrenal incidentaloma, management of adrenal incidentaloma. This is a very important guidelines, and this is published since 4 years. And another one, which is adrenocortical carcinoma, which is not very important because the most important is that is mitotan is one of the most important drugs which can decrease the risk of adrenocortical carcinoma in the adults. This is the most important guidelines. From these guidelines is the adrenal incidentaloma. You can go to the other guidelines, which is chronic hypoparathyroidism and hyponatremia, but the guidelines published for management of hyponatremia is very long and very difficult. Just go to these guidelines, read more, and you can download the PDF file from here. Of course, they will go to published in the EGE guide journal, and you can download the guideline from download PDF. This is just freely for everyone. Everyone can download this guideline from this website easily, and this is the guidelines for hyponatremia. It is about 47 papers, huge papers. It is very difficult guidelines, and I think it is also presented in our website. Another very important guidelines, which is British Thyroid Association, BTA. If you don't know how to go, just write in the Google BTA guideline, and he will go to the British Thyroid Association guidelines. And the most important in these guidelines is thyroid cancer, which is published in 214. This is this is very important guidelines because this is very important guidelines, but you don't need to study this long guideline. You want to know at least some of tables and some of algorithm, and actually I put this algorithm in the YouTube channel. Risk assessment, this ultrasonographic risk assessment is very important in the exam because at least 1 or 2 questions from this figure. And of course, suspicious and benign features of thyroid nodule is very important in the exam because every year they put a question, 1 or 2 questions from suspicious features. Another very important one is this: how to deal with thyroid nodule and when to do redo fine needle aspiration biopsy, and when to go to the lobectomy or just follow up or do total thyroidectomy. This is the guidelines, just a few figures from the guidelines, not more. Another very important guidelines, which is European Thyroid Association. If you don't know how to go to this website, just write in the Google European Thyroid Association guidelines. Even if you miss some not write it incorrectly, it is not very important. I think Google will do it. So you will go to the ETA guidelines, which is the official website, published all guidelines published by the European Thyroid Association, all presented in this website. And of course, the latest guidelines, which is image guided ablation in the benign thyroid nodule. And actually, I do these guidelines in the ThyroAlex, in the ThyroAlex with my presentation about the non-surgical management of benign thyroid nodules. And what is the most important from these guidelines is, of course, thyroid dysfunction following immune reconstitution therapy is somewhat important because in the previous exam they question about this one. And of course, central hypothyroidism is important, but how to manage the Graves' hyperthyroidism is very important. How to manage amiodarone-associated thyroid dysfunction is very important because in every exam there is a question or 2 questions about amiodarone and its relation to thyroid dysfunction. And of course, is thyroid nodule in adults risk stratification is not very important. The most important from this website is amiodarone, Graves' hyperthyroidism, central hypothyroidism, immune reconstitutional therapy. This is the most important 3 guidelines from, and the graves of psalmopathy, which is uploaded in 2016. This also very important guidelines, but the guideline is very hard in this topic. And another one, which how to manage subclinical hyperthyroidism and the subclinical hypothyroidism. This is very important actually in the exam and in our clinical experience. For example, if you want to go to these guidelines, you just click in the download PDF, and after that you will this is the guidelines published by the ETA guidelines for the diagnosis and management of endogenous subclinical hyperthyroidism. Just you need to read and take a lot of information and a recommendation in your clinical practice. And as I said previously, all these guidelines are summarized in one file. I think the last one is Society of Endocrinology. If you don't know, you can go to the Society of Endocrinology, like this, Society of Endocrinology guideline. And this is the official, this is the Endocrine Society. I will go to this, not this one. This is one. This is a Society of Endocrinology website, and you can go to actual clinical practice, and you will go to this one, Society of Endocrinology guidance. Click, and you will find a lot of guidelines specifically for the emergency management of severe symptomatic hyponatremia, pituitary apoplexy, hypocalcemia, and hypercalcemia, and adrenal pituitary insufficiency. Just go to the acute management, and you will find that this guidelines, which is very important. You can just click in the download PDF, and you will receive this guideline. So this is the emergency management of acute hypocalcemia in the in adult patient. And of course, they give some of the algorithm like this. In the hypercalcemia, actually, the algorithm is presented in the hypercalcemia guidelines. And the last one is the Endocrine Society guidelines, because this is a very important guidelines in your clinical practice and in the exam. This is the Endocrine Society website. Just go to the practice guidelines, and you will find all the guidelines published by the Endocrine Society. The most important guidelines published by the Endocrine Society for the exam, actually, diabetes in adults is not very important. Congenital adrenal hyperplasia is not very important. What is the most important is testosterone therapy for hypogonadism. Gender dysphoria, gender is very tough guidelines, but it is very important for the exam. Another one is Cushing, hormone replacement therapy in hypopituitarism is very important. Primary aldosteronism is very important. Adrenal insufficiency, primary adrenal insufficiency, which is Addison's disease, is very important guideline. Another one is Cushing, and actually the guidelines published guidelines about Cushing, one in the 2015 for the treatment of the Cushing, and one 28 for the diagnosis of Cushing, and both guidelines is very important guidelines. Acromegaly also, this is very important guidelines. Androgen therapy in the woman is very important guidelines. Actually, you need to just pick the most important one. Pheochromocytoma and paraganglioma is important because in the exam, for example, I will go to these guidelines, and you can download the PDF file of these guidelines. If you search this one, read the full guidelines here. And of course, this is the official journal of the Endocrine Society, the Journal of Clinical Endocrinology and Metabolism. Just click in the PDF, and you will get the pheochromocytoma and paraganglioma ganglioma guidelines. You will go this file downloaded to your machine, and you can read it. Of course, we discuss it in details, and of course, for example, this is the drugs which affect, and we have a lot of discussion about the major medications that may cause falsely elevated results with plasma and urinary epinephrine, and the most important that acetaminophen, because this is from the exam, can affect urinary epinephrine. Actually, in the guidelines, and we actually discuss it in more details with Mahmoud Izzat and Dr. Ibrahim and Dr. Khaldoun Sufyan, because in the guidelines, this does not affect الميتانيفرين, it just affect normetanephrine causing interference and so on. And of course, another, I think this one algorithm is very important, because if we have suspect skull base and neck, we must do succinate dehydrogenase D or P and C and so on, because if we suspect metastatic paraganglioma, we must do succinate dehydrogenase B and so on. Actually, this is a very important exam, and when we study paraganglioma and pheochromocytoma, you will need this algorithm. And another endocrine society guidelines, I think Cushing is very important. I will go back. So you must go to this websites, all websites, and pick up the most important guidelines you need. Cushing, the treatment, the base is not very important, the acromegaly is very important, the androgen therapy in the woman is very important, the pheochromocytoma is very important, the polycystic is not very important, diabetes pregnancy, this is the old guidelines, this is not very important. The only guidelines for diabetes and the pregnancy is the nice guidelines which published since 5 years. Hypertrophy is not very important. The thyroid dysfunction is not very important, but at least in a clinical practice, you need to study it. But at least in my clinic, I follow the American guidelines for the thyroid. Another one is continuous glucose, vitamin D, adult growth, pituitary incidentuloma. This guideline is very important because there are some updates for pituitary incidentuloma follow-up patient. Hyperprolactinemia is very, very important guidelines, because these guidelines, a lot of question from the hyperprolactinemia in the guidelines, in the exam. Hypoglycemic disorders, adult hypoglycemic disorder also is very important, and we cover it actually in the diabetes interactive discussion when we discuss hypoglycemia. And the last one is diagnosis of Cushing syndrome guidelines. This is a very important guidelines, because at least in your clinical practice, you will follow this guideline. If you want to read more diagnosis, summary and recommendation, this how to follow, and of course you can download the PDF file. This is what you need about the guidelines published needed for the exam. And if you want a summary for these guidelines, actually I will give you a treasure about this all guidelines. Actually I do this file. I have some files, for example this one. This is a PDF file. I already gave it in the previous year. This file contains 367 pages for summary for all guidelines. This is the guidelines, all these guidelines, the glycemic management during the enteral feeding. This is the summary of these guidelines. What is the most important? Then I go to the hypoglycemia in adults with diabetes guidelines. I summarize it. Then go to the glycemic control in the pregnant woman, and so on. All guidelines are summarized in this file. So you just need to study this file from now. All guidelines, European Society of Cardiology or European Thyroid Association, all guidelines presented in this file. For example, type 1 diabetes, this is not a very important guidelines, but I summarize it in this file. This is another one for obesity published by the NICE. and also management of primary aldosteronism. This is the guidelines, and also this is the file. This is a very important file. If you need this summary, this is the guidelines summary. If you go to the our YouTube channel, this YouTube channel, Sohaj Endocrine Group, this channel, and search for guideline, you will have a treasure. This file is 5 hours interactive discussion about all the guidelines you need to study for the exam. الصوت طبعا ده بتاع حبيبنا الدكتور محمود عزت، الصوت الاولاني. الصوت طبعا الصوت المحبب لينا كلنا بصراحه الدكتور محمود عزت. You can view this. I just summarize all the guidelines published by the Endocrine Society, NICE, the Joint of British Diabetes Society, the ETA guidelines, the British Thyroid, all guidelines in this file. This is a 5 hours interactive discussion, actually. So you can just read the file and view this video, and you will have a lot of information about the guidelines. So try to review this file.
Hello.
Okay. The next step for studying the SCE and European board is the question bank. And as I said, the most important is the Oxford Handbook. The next one is guidelines. The third one is solving questions. This is the most important step for exam, because you must train yourself how to rapidly solve the questions. And this is the most important sources available worldwide. One of the most important references is Atul book. Dr. Atul Khalid published a very important book. This is one Atul book. This is book edited by Atul Khalid, based of 5 MCQs for the endocrinology and diabetes SCE, and of course for the European board. This book contains 319 questions, very important questions in the exam, and actually about 10 questions are picked from this book. This classified as pituitary, for example, in the exam, in this book, he gave some question about pituitary, about 62, I think 62 question about the pituitary. Some of question is very difficult, some of questions is very easy. And after finishing the pituitary questions, he gave the answers. I think 62 or 60 question. After that, he gives the right answer and give explanation and comments about why they choose this answer. For example, I will pick only one question from the thyroid, any question from the thyroid. For example, this one, 20, for example, 20 question, okay. For example, this question. Here in this question, he mentioned that a 70-year-old retired teacher presented to the thyroid clinical with a 3 months history of anxiety, recurrent bouts of palpitation, and increasing sweating. Before reading this question, you need to how to solve the question. Try to, during reading this question, to pick up some of words that mention another disorder. For example, when you see 3 months history of anxiety, recurrent bouts of palpitation, and increased sweating, you must suspect this is a case of thyrotoxicosis. He had a past medical history of hypertension and AF. AF, he may receive amiodarone, so amiodarone can affect the thyroid parameters. So this, you must put it, this in your mind once you see AF. And after that, he was taking amiodarone. So amiodarone can affect the thyroid function test, can affect TSH and the free T4 and T3, and also can cause hypothyroidism and can cause hyperthyroidism. Hyperthyroidism, amiodarone-induced thyrotoxicose type 1 and type 2. One of them need corticosteroid, which is type 2, and type 1 need carbimazole. And how to stop amiodarone or not to stop amiodarone. Once you see amiodarone, you must put in your mind all of these things to rapidly answer this question. The patient received amiodarone, lisinopril, and bisoprolol. Lisinopril is not very important. Bisoprolol. The most important here, AF, amiodarone. TSH is low. Free T4 is 30, so it is elevated. And so the patient is thyrotoxic. Anti-TBO positive, anti-TBO from the lecture, it is a marker of autoimmune thyroid disease, but is not specific for any thyroid disorder. A TSH receptor antibody is negative, so this is not a Graves' disease. So thyrotoxicosis, but not a Graves' disease because the TSH receptor antibody is negative. He undertaken radioactive iodine uptake, which show this nodule. This nodule, toxic nodule. So we suspect this is a toxic nodule. So في underlying thyroid pathology, and the patient is thyrotoxic, and the patient already therapy is negative. So this is not a Graves' disease, but the anti-TBO is positive. So I think the patient received amiodarone, which can affect the thyroid. Which of the following is the most appropriate therapeutic action for his further management? Carbimazole, prednisolone, propranolol, radioactive iodine ablation, subtotal thyroidectomy, according to the underlying thyroid pathology. It is amiodarone-induced thyrotoxicose type 1 or type 2. This is very important because type 1 need carbimazole, type 2 need corticosteroid. So this is very important. Subtotal thyroidectomy is not the first option in most conditions because you must render your patient euthyroid and so on. So if you go to the answers from the book, I will go to the question 20. This is the thyroid, the 20 question. This is one, which one? This is 121, 21. So I will go to the 21 question. So they ask, it is amiodarone therapy, LA, because this is amiodarone therapy is commonly associated with thyroid dysfunction and differentiate between amiodarone type 1 and type 2 and so on. So in this question, you need to highlight the most important topics. There is underlying thyroid nodule. There is anti-TBO positive. So this is recommend amiodarone-induced thyrotoxicose type 1. So the most important to manage this patient is carbimazole. Of course, this toolbook is very important and very important to start with. But I suggest if you have money, buy the book, the original copy of the book, and try to solve the questions a lot of times because it have a lot of information for the exam. But you must know there are two questions the toolbook answered incorrectly, or actually according to the previous guidelines. I think one of them, one of the question is the adrenal one. Actually in our discussion we discussed it because they choose the question according to the previous guidelines, not to the according to the recent guidelines. I will look for the chat. Okay, I will look for the chat after finishing. Another one, which is exam lab, but the most important is the exam lab. The exam lab have no explanation, but actually if you go to the Sohaj endocrine group here, I will go to and search for the exam lab. You will find only question of the exam lab. We discussed it previously and give explanation for real questions. For example, this 4 hours the YouTube file, you will find the exam lab with explanation discussed with my colleagues previously.
Endocrine.
So this is the question, for example, and we will discuss it, why we choose this question, and this دكتور أسامة والدكتور خلدون ما شاء الله عليهم وحشين كتير. Exam lab, if you see the exam lab questions, I will go to the exam lab questions. This exam lab question, the file is already uploaded in a lot of websites. This file contains 200 best of 5 questions. Actually, in every year, 30 questions from the exam lab. Every year, 30 questions from the exam lab. Even the options are the same. Even the order of the options are the same. So every year there are questions from 30 questions. It is a very about 15% of the exam from this 200 questions. So you need to study it more and more, but don't start by this one, because there is no explanation in this file. You will see that just like this. Actually, this is very important image for pituitary, maybe non-functioning pituitary adenoma or so on. I think it is serum prolactin 1000, so it is a non-functioning pituitary adenoma and compressing pituitary stock and so on. Actually, this is a very important file. Before the exam, you must read it more and more. This file is very important, but not to start with. How to start with? I think Dr. Atul book is very one to start with. Another one, which is on examination, SCE file. Actually, this examination contains 719 questions already. I uploaded a PDF file and have a lot of explanation. But you can already subscribe for this if you go to the on examination website. This one on examination, which is this one on examination website, and you can go to the exams, this one, and go to the SCE in endocrinology and diabetes, and you can apply and share if you want only 1 month duration. This is the fees by stellini. If you want more 3 months, it is about 100 stellini and go on. If you choose this, if you apply for on examination, a British Medical Journal examination website, this is very important, but I think it is just a few questions different or more than my file. This file actually already I uploaded in most of the websites and Telegram and so on. And actually also we discuss it in more details in our group. If you go to this group and go to the search for on examination, you will find that most of a question on examination on OE, I think OE, I think a lot of questions from the on examination. For example, this one, a lot of questions. يعني actually we solve all of questions from these banks in our website. So you start with a toolbook and on examination website or SCE exam. Another very important one is study BRN. Study BRN is very important source, and actually also I do the PDF file, which is already contains about I think 478 questions distributed all over the different chapters from the Oxford Handbook. For example, in the adrenal, there are 30 questions from the adrenal, complication of diabetes 45, and so on. And this question also has a lot of explanation for every question. After answering the question, there is explanation for it. If you have money, you can study BRN. This is the official website of study BRN, and you can go to the exam review. This is the SCE in the endocrinology and diabetes. This is the website which contains 580 questions. Actually, in my file, my file contains less than this because I make it since 3 years ago. But in the previous 3 years, they add about 100 questions. One of the most important thing about the study BRN, some questions are answered according to the previous guidelines, not updated one. When you see a diabetes numbers, please upload these numbers in your notes. And of course, study BRN is very important source to pass the exam. And another one is a practical diabetes website, and also this is just contains a few number of questions in comparison with other one, and does not contain diabetes questions only, but also contains adrenal, pituitary, and thyroid, but the most portion about diabetes. And don't forget that MODI and the types of MODI is very important in the exam, because at least 1 or 2 questions about MODI, how to diagnose, how to manage, how to select, when to choose, select MODI 5, for example, or MODI 3, and so on. Another one, very important, if you have MRCP questions for part 1 endocrinology portion or part 2, I already collect the questions for MRCP part 1, the endocrinology questions from the own examination, past test, MRCP, pass, revise MRCP, and pass medicine, and put them in only one file. You can study them. Don't forget that the questions from MRCP part 1 is easy questions, not very hard like the exam. But in the part 2, this is a hard, some of hard questions similar to the exam. So you can start by MRCP questions for part 1. This is easily to start with, and after that go to the MRCP part 2. And the last thing is the website questions. Already, if you go to the website, I will go to the MRCP UK, this website, and I go to the specialty certificate. I will go to specialty. I will choose endocrine and diabetes. Here in the website, there is a sample questions. I can go to this interactive sample questions. It is about 70 questions, the same European board questions, the same as SCE questions. And if I write my email, just start, they will give about 70 questions, which is very important. I must choose I am not a robot and start. This question is very important because in the final exam, they at least 2 or 3 questions, the typical question as the website. This is very important. This question is not easy. It is somewhat difficult, and I will just discuss this question. It is a 45-year-old man was referred with a 6-year history of polyuria polydipsia, 6 weeks history of polyuria polydipsia. So this is a patient of type diabetes. Is it type 1 or type 2? I don't know, but there is a 7 kilogram weight loss. So there is a catabolic state. So I suggest it may be type 1, even if the age is 45. One week previous, his general practitioner had diagnosed type 2 diabetes. This is a logical thinking, and had started him on the metformin. The patient had made appropriate change to his diet, but this fasting plasma glucose reading remained above 15. Don't forget that in the UK and in the exam, the units is by millimole per liter, not milligram per deciliter, and usually they give the normal reference range between prices. He was feeling tired but was otherwise well. On examination, the body mass index is 34, so the patient is obese. This is not against type 1 because the prevalence of diabetes worldwide is very common, because so we can see a type 1 diabetes which is obese. Urine analysis shows glucose is 3+ and ketones +2, which is suggests the patient may be type 1. The sodium is normal, the potassium is normal, the bicarb 23 normal, the creatinine is normal, the fasting plasma glucose is very high. What is the most appropriate additional treatment? This is very important. Exenatide, gliclazide, intravenous insulin fusion, pioglitazone, subcutaneous insulin, and you must check, choose one option and go to the next question and so on. And actually, if you choose one, they just add a small explanation for this question. And actually, I collect all these questions in a file like this. And you will find this is our question. This is the first one. So they choose subcutaneous insulin. Patient has feature consistent with type 1 diabetes. This is just a small explanation, but the questions in the website is very important in the final exam. So how to start with? I suggest that you start by a tool book. I will go to my presentation. To start by a tool book. After that, on examination. After that, study PRN, practical diabetes. And of course, if you have a time, you can start with MRCP part 1 and part 2 questions. And the last one to solve is exam lab and website questions, because these questions is very hard, because these questions is typical as the exam questions. So don't start with, because these questions have no explanation. But don't forget that these questions, these answers from the website is the correct one, because some of my colleagues discussed previously that some of the questions answered is not correctly, but I insist that choose the questions answers that published in the exam lab and website. This is very important. After that, I go to the next question, and after answering all the question, you will see some of the explanation. For example, this second question: a 55-year-old woman had previously been found to have. You must try to read a question like that. The manner I read with. Have a 4 centimeter papillary thyroid carcinoma. She had treated with surgery and radioiodine and subsequently has undetectable thyroglobulin, but a high titer of antithyroglobulin antibody. What is the most appropriate investigation? Is the annual follow-up, الانتيثيرويد peroxidase antibody, CT scan of the chest, of the neck, البيت scan, الالتراساوند, الwhole body iodine scan. You must choose which one. So this is a patient of papillary thyroid carcinoma. Anti-TG is positive with high titer, but the TG is negative, undetectable. So it may be assay interference because the anti-TG is positive. Anti-TBO, you can answer a question like this by exclusion. For example, anti-TBO is not very important. A CT scan of the neck. Why we do CT scan of the neck? Actually, the first bedside maneuver is ultrasonography. So choose ultrasonography. Why you do a CT? Do at least ultrasonography, and after that go to the CT scan if you suspect a recurrence of papillary thyroid carcinoma. Whole body iodine uptake scan. And not the first option here, except if you suspect a recurrence. And also PET scan has no role in any patient of thyroid nodule as initial investigation, and so on. This is how to think about solving question from the bank and go on. Actually, this is a very important website. This is the last question to solve, but you must know that all questions you must repeat it more than one time. And actually try to take a print copy from these files and solve the question. Easy question, right beside it, it is easy. The hard one, right, it is hard, and you want to repeat it more and more, and read the explanation. The most important in the solving question, not to solve the question, it is to read the explanation, which is very important. The explanation will answer another questions. Don't forget that the exam is 200 questions, and you need in the previous banks it contains about 100 questions from the same styles, but you can answer all question if you read the comment and explanation from these banks. This is just how to think about the questions in the exam, and I will put for a question. I think I near the end of my presentation today. Just ثانية نحط الشحن بس. This is a same questions from the official website. This is a question for how to think about the question. It is a 47-year-old woman who is referred with abnormal thyroid function. She had a long history of seizure disorder. Once you see seizure disorders, you must suspect that there is a drug that may be interfere with thyroid function test. Phenytoin, carbamazepine, these drugs can affect a thyroid function test. If you see a seizure in a pituitary question, you must suspect that intracranial tumor. You must suspect drugs that can affect the insulin tolerance test. يبقى so insulin tolerance test is not appropriate method to assess the growth hormone, and the alternative is arginine or another one, which is clonidine or glucagon, and so on. And mental health problem. She had felt tired. Once you see a tired in a pituitary question, you must suspect growth hormone deficiency, hypogonadism, hypoadrenalism. This is how to think to solve a question. Here, menstrual cycle was regular, so menstrual cycle is regular. This is very important because in this scenario, if the prolactin is elevated and does not affect the menstrual regularity, so this may be macroprolactinemia if the question about the pituitary. With no galactorrhea, so it is very important also once menstrual cycle is regular, so even if the prolactin is elevated, it does not affect ovulation. Here medication included daily phenytoin, so this is a drug which can interfere with a lot of things. Lovromide, tazodone, lansoprazole. On examination, the pulse is okay, blood pressure is okay, no posture pressure drop, and appeared euthyroid with no goiter. Here visual field. The cortisol is according to the reference range is good. LH is elevated. While LH elevated, is it LH producing pituitary adenoma? No. The patient is female, which is 47, which is perimenopause. So LH elevation mostly due to the perimenopause, not due to the LH producing a tumor and so on. The prolactin is mildly elevated, maybe drug induced or someone. It is just mildly elevated. It's not very important. The TSH is normal and the serum free T4 is low. So TSH is normal, serum free T4 is low. So this is maybe central hypothyroidism. Okay, maybe drug interference, maybe. So in this option, what is the most likely explanation of the abnormal thyroid function test? If you suspect, for example, assay interference cannot be excluded. Cushing syndrome. Why Cushing syndrome? There is no any criteria suspect Cushing syndrome. Effect of phenytoin may be a non-functioning pituitary adenoma. The prolactin is mildly elevated. But what other things which suspect a non-functioning pituitary adenoma, the patient is non-symptomatic. And to increase the prolactin, you need to be macroadenoma, which can cause a headache and so on. A non-thyroidal illness or sick thyroid syndrome, in this situation, this is a low T3 syndrome, and the patient is critically ill and admitted to the hospital. So a non-thyroidal illness is not, we must remove the non-thyroidal illness. El-Cushing must be removed. So it is SCE interference, effective phenotype, and non-functioning pituitary adenoma. So you must choose by this, and after that, you must know that phenytoin will decrease the free T4 by some extent. This is very important. And after that, so we must exclude some options, and the answer is phenytoin. And this is the explanation, and I collect this table, a drug that can affect thyroid function tested TSH, T4, free T4, T3, free T3, and the mechanism of action to induce these options, because this is a very repeated question in the exam. The patient already on some drugs which can affect the thyroid function test. Another question, this is a patient with 50 years old female presented with palpitation and the slight weight loss. This is a manifestation of thyrotoxicosis. She has, of course, the right explanation from my thinking, not from the exam. She has an eventually medical history, take some supplementation. Once you see supplementation, you must suspect heterogenic cause of the case scenario. This is very important because the supplementation can cause, the supplementation can include some drugs or some herbal medications that can interfere with the condition. But she buys in a healthy food shop. She is a non-smoker and drinks little alcohol. There is a maternal aunt who have underactive thyroid, but nothing else of note. There is a family of thyroid disorder. On examination, she has a pulse of 86 beats per minute, and the blood pressure is okay. She has a fine tremor. Fine tremor can cause any cause of thyrotoxicosis, can cause fine tremor of outstretched hands, and there is a slight lead leg. Also, lead leg is not a pathognomic to thyrotoxicosis, not pathognomic to Graves' disease. Oxophthalmos is a pathognomic feature for a Graves' disease, but a lead leg can be presented in any case of thyrotoxicosis. No goiter is palpable. Thyroid function test, the free T4 is elevated, the free T3 is normal, TSH is low. So the patient TSH is low, the free T4 is elevated, the free T3 is normal. So this is a case of thyrotoxicosis. But the free T3 is normal. This does not exclude the thyrotoxicosis. Thyrotoxicosis per se, T4 is elevated, TSH is suppressed. But the most important, and the clue for this question is thyroglobulin is undetectable. This is very important. What is the most likely diagnosis? This thyroglobulinaemia, factitious thyrotoxicosis, Graves' disease, hashitoxicosis, toxic nodule. Of course, the most important clue to solving this question is thyroglobulin, which is undetectable. You must know that thyroglobulin is elevated in all thyroid disorders except factitious thyrotoxicosis. This is very important. And of course, thyroglobulin may be undetectable if the patient is due total thyroidectomy, and after that have a radioactive iodine ablation therapy if the patient is differentiated thyroid carcinoma. And this is a logic. You move the total thyroid and give radioactive iodine suppressive ablative dose. So all cells of thyroid which secrete thyroglobulin are removed. So this is how to think about this question. Another question, 18 years old man present with a thyroid clinic complaining of the lump in the neck. So lump in the neck means thyroid nodule or thyroid or lymph node that had been present for 9 weeks. It was not painful. At the age of 12, he had developed acute lymphoblastic leukemia. So this there is a history of lymphoblastic leukemia. and are undergone bone marrow transplant preceded by total body irradiation and cyclophosphamide. On examination, he has a euthyroid and 1.5 centimeter firm mass on the left side of the neck. So, which moved when he swallowed. So this is a thyroid nodules, a size 1.5 centimeter. Investigation, you must suspect in any thyroid nodule, the first step is to do TSH. This is the first step in any thyroid nodule. If TSH is low, the next step is to do thyroid scan. If normal, the next step to do fine needle aspiration cytology, except if ultrasonographic patterns according to the British Thyroid Association is U1 or U2. U1 means normal thyroid, U2 mean a benign thyroid nodule, surely benign thyroid nodule. So if in the question ask about, give a question and give U1 or U2, no need for thyroid nodule. Other TSH is normal or elevated, so the patient is EU or hypothyroidism, the next step is to do fine needle aspiration biopsy. If TSH is low, the next step is to do thyroid scan, not fine needle aspiration biopsy. But in some questions, for example, if the same scenario and give a TSH is low, so the next step is to do thyroid scan. But in the case scenario, if he give you that TRAB is positive, so in this case scenario, the next step is to do fine needle aspiration biopsy, because already we know that TSH is low due to the underlying Graves' disease. But TRAB is positive, TSH is low, a thyroid nodule usually in this scenario is cold, so we must do fine needle aspiration biopsy. So if TSH is low and there is a thyroid nodule, the only indication to do in this scenario fine needle aspiration biopsy if TRAB is positive. So in this our scenario, serum thyroid TSH is normal, if T4 is normal. What is the most appropriate initial course of the action? Of course, a CT scan of the neck and thorax is not an first step in any case scenario, except if you suspect a compression. In this scenario, a CT scan may be an option, but of course the flow lobe spirometry is the first option. If not available, so is CT scan. So the correct answer is ultrasound guided fine needle aspiration biopsy of the nodule, and this is how to think about this scenario. The last question. This is a case of a 43 years old woman was admitted with right lower lobe pneumonia. Once you see pneumonia, you must suspect thick euthyroid syndrome. This is the most important one. But actually, the patient is admitted with right lower lobe pneumonia, which is not severe enough to give thick euthyroid syndrome. Thick euthyroid syndrome, this is a very critically ill patient which can affect the thyroid function status, and was found to have AF. So as we mentioned the previous, AF is the patient maybe received amiodarone, and amiodarone can affect the thyroid status, a thyroid function test, and can make hypo or hyperthyroidism according to the situation. She had a history of bipolar disorder for which she was taking lithium, and you must suspect lithium can cause hypothyroidism. This is very important. Lithium can cause hypothyroidism, so TSH must be elevated. Here, menstrual period were normal. Investigation, TSH is normal. This is very important. The patient is euthyroid. T4 is elevated. T3 is elevated. So T3 and T4 is elevated, with the TSH is normal. So this is a case of central thyrotoxicosis, central hyperthyroidism, or maybe drug interference. Assay interference has been excluded, so drug interference is excluded. Subsequent investigation, sex hormone body globulin is normal. Serum thyroid hormone receptor alpha subunit is 0.8, which is low. Well, anti-TPO is negative. So this is a case of central thyrotoxicosis. What is the most likely explanation? Diagnosis, of course, as we mentioned, that lithium can cause hypothyroidism. Lithium-induced hyperthyroidism is not correct, because in this situation, TSH must be low. lithium-induced hypothyroidism, TSH must be elevated. So lithium can cause hypo or hyperthyroidism. The most common is hypothyroidism in this with lithium. But in the case of lithium-induced hypothyroidism, TSH is elevated. In lithium-induced hyperthyroidism, TSH is low. In non-thyroidal illness, in this situation, TSH is low, T3 is low because there is it is called T3 low T3 syndrome. يبقى in the thick euthyroid syndrome or non-thyroidal illness or low T3 syndrome, TSH must be low. And of course, as mentioned, the patient is complained by right lower lobe pneumonia, which is a simple condition which does not indicate sick euthyroid. Cerebraceous ingestion of thyroxine. In this situation, this is a factitious hyperthyroxinemia. In this situation, TSH must be low. So in every primary thyroid disorder, TSH must be low or elevated before T3 or T4. So in this scenario, TSH is normal, T4 is elevated, T3 is elevated. So this is a case of central hyperthyroidism, which is maybe thyroid hormone resistance or TSH home. Which one? So all options are excluded from the scenario except TSH, thyroid hormone resistance or TSH home. So you need to study how to differentiate between these two options from the Oxford Handbook. And also, European Thyroid Association gave a guidelines for this TSH-OMA, at least for TSH-OMA, but this is not a very important guideline. Of course, the clue here is thyroid hormone receptor alpha subunit. This is the clue, because this alpha subunit will be elevated with TSH-OMA and will be normal or low with thyroid hormone resistance. So how to answer this question, this is from my next book, inshallah, how thyroid hormone resistance syndrome, and actually in the every year exam, there are one or two questions how to differentiate between thyroid hormone resistance and TSH-OMA and how to manage it and how to diagnose it. And also this table from the Oxford Handbook. And actually, in the previous, not the latest exam, in the previous one, which held in the 2019, there is a question about a TSH response to TRH, which secondary hyperthyroidism TSH. Usually, in the TSH-OMA, no change after injection of TRH for TSH, but in the thyroid hormone resistance will be increased the TSH after injection of TRH, and very important. And also, this is a clue for the previous question. The alpha subunit will be elevated in the TSH-OMA, but normal in thyroid hormone resistance, at least elevated more and more in the TSH-OMA. And actually, if you review our interactive discussion, which is available in the YouTube channel, where you find all this controversy about these numbers, because in this table they mentioned that the alpha subunit is elevated in 65%, but it is also elevated in 2% in the thyroid hormone resistance. But the more common, the commonest thing is the more common is more common actually. And of course, the pituitary MRI can detect TSH-OMA in most of cases, but in 30% it is a microadenoma, and in 70% it is a macroadenoma. Of course, differentiation between the TSH-OMA and the thyroid hormone resistance is very important in the exam. The differentiation between the type 1 amyloidosis thyrotoxicosis and type 2 is very important in the exam. And the last thing, if you want to pass easily, start from today, and this is all things you want to study with. The Oxford Handbook of the Endocrinology, it's the only book you want to study. Our YouTube channel, Suhaj Endocrine Group, and this is the all guidelines you need to study. Diabetes guidelines published by GPDS, DKA, enteral feeding, hypoglycemia, surgery during delivery, diabetes with pregnancy, type 2 diabetes in adults is very important. Thyroid guidelines published by British Thyroid Association and Thyroid Cancer, just 2 figures or more about the risk stratification by thyroid ultrasonography and U system, and of course SCE classification, and also the European Thyroid Association guidelines, Graves and subclinical hypo and hyper, And in the pituitary guidelines, the acromegaly, hyperprolactinemia, hypopituitarism, and pituitary incidentoma published by Endocrine Society, and the adrenal incidentoma published by the European Society of Endocrinology, and Endocrine Society guidelines, Cushing, pheochromocytoma, primary aldosteronism, and primary adrenal insufficiency. And this is all questions you want to read and study well from today. الأتول book on examination and study BRN, practical diabetes, and MRCP part 1 and part 2 question of endocrine, and lastly exam lab and official website. And don't forget that I already collect the previous exam recall for the previous 5 years. This is very important. And also this all files are already available in the website. I will go to this one. A previous exam, this is for example 206. This is the recall for 2016. For example, this is a question. Every exam there is a question about the mechanism of action of carbimazole every year. So don't answer it incorrectly, because it is very easy question. And already I already give a comment about this recall. And another one for 2017, this is a recall, and this you will find mechanism of action of carbimazole, and I give some explanation how to choose the correct answer and how to answer it. And this is a year which I already passed the SCE, so I write the question recall like this, because this is just, for example, from the exam, I think exam lab or another source. This is very important one. And another one for the 2000, this one, the previous year, I already collect this in this year, 2019 exam. I already passed European board from this year, and I collect all the question. And I actually already collect the question which in the latest one, and but I already want to write it in a PDF files. This is the latest one, the exam held in the previous December, since 1 month. So I will collect and distribute it for everyone. And if you go also to our YouTube channel, I will go to the YouTube channel. If you want to someone, okay, if you go to our YouTube channel and write recall like this, you will find all the recalls, the previous recalls, and the answers. For example, if you click for this video, this is a video, it is a length more than 4 hours and 67 minutes, continuous interactive discussion with my colleagues about the questions from this recall. So this is a very important to study this recall, because we discuss it in more details and more and also if you can go to the other records for 20, for example, this is for the 2 years ago, and so on. And also in the website you can go to the only questions about the adrenal, some question about the gonads, a lot of hundreds of interactive discussion you will find in this website. So I think I need to reach my
Dr. Khalid?
Yes.
What about your notes?
What?
I think you are collecting and making a book.
Yes,
what
yes,
about that?
I am already working on it. Actually, I just finalized. I will give you a hint about this book, actually, but I just working on it. Actually, not completed, because I have. I will try to.
When will it complete, by the way?
Actually, I don't know, but inshallah, in the near future, I will do it. This is just I will go to. This is just one chapter. Thyroid. This is what will be appeared inshallah in the next. I just do how to, and actually from this portion about I suspect that about 5 questions in the final exam, and I do the book like this, and I highlight the very important topics which be presented as a previous question, like this is from my book, and after that I give a lot of interactive tables like this, and what is most important for the final exam and how to solve this. And after that, I give a lot of questions like this. And after a question, I give a hints about to how to solve these questions and give some explanation. I choose some questions and answer it. I just do 2 files, and I think this is one for thyrotoxicose. I think inshallah in the next few weeks I will complete a very important part from this book, and at least I summarize the guidelines like this. In the book, I choose the most important guidelines and I try to summarize it, but actually it needs a lot of time to finalize and make it that I want. At the end, I will give, we have a time to discuss what is uploaded as questions. This is some thankful message sent to me. One of the most يعني من الحاجات اللي فرحتني كتير، احد الزملاء بعت لي رساله كنت منتظرها بصراحه. دكتور خالد الحمد لله نجحت، فرحتني كتير. Another one, hello, Dr. Khalid. I just want to thank you profusely for all your videos guidance for the SCE exam. I passed this exam and I am very grateful to you. And actually, الشكر مش موجه ليا لوحدي بصراحه، لان زي ما بقول ان في ناس كتير من الزملاء ساعدوني في اخراج هذا الموضوع. شكرا للدكتوره امل، شكرا للناس اللي كانت بتذاكر وهي بتطبخ وهي بتشتغل. ما حبيتش احط اسماء بصراحه لان كلهم يعني with the God grace. اهم حاجه الدعاء، اهم حاجه الناس تدعي لي وتدعي للمجموعه كلها ان ربنا يعديها على خير لنا كلنا. شكرا لكم جميعا. ان شاء الله انا احاول ابص على بعض الاسئله. طبعا
حضرتك سامعني؟ انا الدكتوره اسماء. حضرتك سامعني؟
يا دكتوره اسماء انا سامعك، اهلا وسهلا.
دكتور، ان شاء الله داخله الامتحان في شهر 6 اللي جاي. كان في نقطتين عايزه اسال حضرتك عليهم. شكرا ليك طبعا لمجهودك.
معاكي دكتوره اسماء.
لو سمحت يا دكتور، بالنسبه للصور I will speak in English for everyone to listen to me. What about pictures? The pictures of MRI pituitary MRI adrenal يعني بتيجي بنسبة قد ايه في الإكزام؟ Are they difficult? Should I study special time in my time للpictures؟
Yes, the most important in every year they about 10 questions images about this number. Actually some years more and some years less, but the most important in every year they present a 1 or 2 question about CGM, continuous glucose monitoring diagram, and how to analyze it. They give a CGM report and they want to increase, for example, basal insulin or decrease the prandial insulin and so on. Analyze this one. This is actually is not a very difficult one. Another questions image they presented usually 2 questions about the pituitary imaging, and actually hypophysitis. This I can, for example, I will show it in the previous exam. This one I will show it. This file I will give. If you find, you will find that a question from the pituitary. For example, they will give us this image, which is thyroid scan, which is a Graves' disease. For example, this thyroid usually give an image with thyroid scan. And another one with adrenal, they give an image, MRI or CT. And this image in every exam, this is image must be in your exam. So we discuss it in more details, these joints and these bones and how to study. And because in every year, this image must be in, you must solve it in the exam. Every year, this image is mandatory. And another one is retinal imaging. There is two questions about the retinal imaging. This is not actually very difficult in the exam. And another one, I will do this one in our exam. They mentioned this image, which is, but actually we solve this question not from the image, but actually from the scenario, because this patient is 18 years old, present with a 2 months history of polyuria polydipsia, and it is actually it is lymphocytic hypophysitis, not from the image actually. And another one also, lymphocytic hypophysitis is very common in the exam, and they in our previous exam they give two questions about the lymphocytic hypophysitis. One from the image, I think it is from Medscape. This one, this is from our exam. They give the same image. This is lymphocytic hypophysitis. And also they give a question about, I think, a PET scan, or I think this image, I think from my file, I will go to the my file, this one. I think day one. Image like this one, and I mentioned this one, the same image. They give this image, which is a PET scan for the neck, and of course this once a PET scan show a thyroid nodule, the risk of malignancy is about 20 to 35%. A risk of this nodule to be malignant. I think it is about 10 images.
10 pictures.
10 pictures.
Images in each exam.
Yes. It is the most retina, الfoot. This is very important. CT abdomen or MRI and MRI pituitary to image about the MRI, and continuous glucose monitoring, at least 1 or 2 images.
Okay. Dr. Khalid, please, في التليجرام group there is questions of stat pairs والإيساب. These are American questions.
Yes.
They are using American guidelines. Are they important بالنسبة لي إن أنا أحاول أذاكر منهم besides ال question banks اللي حضرتك قلتهم؟
Actually, if you have a time, read them. These banks are very difficult, but it is to some extent will increase your knowledge how to solve the questions. But if you face a question and the answer depends on the guideline, go with the nice guidelines. Actually, there is a minimal difference between the nice guidelines and other guidelines. The most important in diabetes numbers, for example, how to diagnose GDM, according to the nice guidelines, they mention that only fasting and 2-hour reading. But in the American, we can do 75 oral glucose tolerance test or 100 oral glucose tolerance test, and we can do fasting at 1 hour, 2 hour, and 3 hour if we have 100 glucose tolerance test. But according to the nice guidelines, they only according to the first and 2 hour. There is no 1 hour or 3 hour in the nice guidelines.
Yes.
And this is the most important. And also, if you see adrenal pituitary incidentaloma, for example, the American Association for Clinical Endocrinology have a guidelines about the adrenal incidentaloma published 209. And this is the old guidelines. I will show it actually, because this is very important to mention about. I will go to the guidelines. It is guidelines. This is one about adrenal incidentaloma. This is and you will see this one. This is the old guideline, and actually a question in the toolbook answer according to the guideline. If you see this guideline for adrenal incidentaloma, if less than 4 centimeter with benign criteria by a hue less than 10 and so on, and after that the patient hormonally active, yes, you go to the adrenalectomy. If not hormonally active, follow up patient with repeat CT scan and biochemical evaluation. But if you go to the Endocrine Society guideline, I will go to the Endocrine Society SCE guideline for adrenal syndrome. This one, this is the guideline. You will see this difference. This is the difference. I will go to this one. This is one. The patient is functionally active, no potentially malignant, intermediate, not this one. I will go to this one if not functionally active. I actually tab, okay, I will do it from this portion.
Once we get your book, these all things will be easy then.
I don't know, but I hope it is near time. I will go to this. Actually, in our presentations, interactive presentation, we discussed it. Thanks. Here, we suggest against further imaging of follow-up in patient with adrenal mass أقل من 4 with clear benign features. This is very important. And this is another one. We suggest against repeat hormonal workup in patient with a normal hormonal workup at initial evaluation, unless there is a new clinical sign. In a toolbook, actually, there is a question, and in a toolbook, he answered according to the ACE guidelines, which recommend follow-up patient with repeat CT and biochemical evaluation. But in the latest guidelines published by the ESE, they does not recommend the hormonal workup if the initial hormonal workup is normal, except if there is a new clinical signs of endocrine activity. And I think if I go, I will show actually this question from the toolbook. This is the only difference. But if you have a time, please read ESAB. This is a very important, at least for your clinical experience. I will incorrect answer. This is one from the toolbook. This is one. This is a question from the toolbook. I will show. This is I will maximize it. This is a 42-year-old woman present to the accident emergency department with a sudden onset of anxiety, palpitation, and headache. On examination, the blood pressure was okay. Fundus, blood pressure is elevated. Urine norm meta-adrenal is elevated. I think this is another one. This is another one, not for these guidelines, but this is answered incorrectly actually in the toolbook, because here they okay, this is one. This is incorrect answer because in the toolbook they choose CT MABG scan, but the correct one is CT abdomen. And also the question I mentioned previous about the ACE guidelines about the adrenal syndrome, also you will be find in the toolbook answered incorrectly according to the ACE guidelines.
Thank you, doctor. Thank you very much. ربنا يبارك لك ويعزك يا رب.
I will try to see the questions chat. If anyone want to ask me the direct questions, it is welcome.
Yeah, the direct question is the request to make a book earlier for us.
Inshallah, بمشيئة الله, inshallah.
السلام عليكم.
وعلى السلام.
دكتور خالد، معك دكتورة آلاء. دكتور
أهلا وسهلا دكتورة آلاء.
أهلا وسهلا بك دكتور. بس بالنسبة حبيت أذكر نقطة بس بالنسبة للدكتورة أسماء لما سألت على أسئلة الإسابة أو الأمريكان جايد لاين في الامتحان الأخير اللي كان في ديسمبر.
مبروك نجاحك يا دكتورة آلاء الأول. أنت آلاء صاحبة الرسالة اللي حطيتها على فكرة على ما أعتقد.
تمام. أي نعم دكتور.
يا أهلا وسهلا بحضرتك.
دكتور في الامتحان الأخير كان أسئلة الثايرويد كانسر مطلوب الإجابة according to American Thyroid Association. تقريبا سؤالين اجوا على الثايرويد كانسر كان specifically يعني ذاكرين according to American Thyroid Association.
يعني هو في السؤال كتب according to the American guidelines؟
سؤال أو سؤالين حسب ما، سؤال واحد متأكد منه، لكن السؤال الثاني ما أتذكر هل أيضا ثايرويد كانسر ولا توبك ثاني، لكن متأكدة كان كاتبين بالكلمة according to American Thyroid Association guideline، والسؤال طالبية فهي already على American guideline، وفي أكثر من سؤال على Endocrine Society guideline.
Yes, the Endocrine Society, and as I mentioned, it is very important, and I put all the guidelines, especially الفيوكروموسيتوما, الأكروميجالي, البيتيوتري انسيدنتالوما, الهايبربرولاكتينيميا, الكوشنج diagnosis and treatment. Endocrine Society is very important, and it is already accepted worldwide. Endocrine Society. طب تفتكري السؤال بتاع الثيرويد اللي بتاع المكتوب اجابته according to the American guidelines؟
والله هو على الثيرويد كانسر، لكن بصراحه ما اتذكر بالضبط. وحتى الثيرويد نوديولز، الاسئله اللي كانت تيجي على الثيرويد نوديولز كلها كانوا يذكروا الكلاسيفيكيشن اكوردنج للبيثيسدا وكذلك للثاي على حسب
هو الثاي اكشوالي البريتش ثيرويد اسوشيشن الثاي is the same as Bethesda according to the British Thyroid Association also, but the most important EU classification is not mentioned in the American Thyroid Association guidelines, which is very important and published in the British Thyroid Association. لو حد عنده وقت طبعا الامريكان guidelines في الثيرويد بصراحة is very important and clear clinically, and I already يعني بتبع الامريكان جايد لاينز في الثيرويد بصراحه, but in the exam you need at least اليوروبيان جايد لاينز, and if you have a time try to read American guidelines. The difference is not كتير, يعني حاجات صغيره, تركات صغيره, حاجات صغيره يعني. لو تفتكري اي اسئله من الاسئله بتاعت الثيرويد لو تحبي تتكلمي فيها دكتوره الاء نشوف القصه دي عادي يعني.
والله حاليا ما حاضرني, بس هي كان التوبك اللي متاكده منه كان على الثيرويد كانسر يعني, بس ما حاضرني السؤال بالضبط يعني بصراحه.
There is a question about what is the average time needed for preparing well to the exam. Actually, I don't know. It depends a lot about your experience in the endocrine. 3 or 4 months is very sufficient if you have a background knowledge sufficient to if you already practicing endocrine in your clinic, in your hospital, I think 4 months is very sufficient. But if you start from the beginning, it is very difficult to pass by studying for 4 months. If your knowledge is not good enough, prepare for the next year. If you have a background knowledge on the endocrinology and the guidelines, so you can apply. Don't forget that start for application in the next month, and you will apply and do a fees in the next month, so you have no time. Actually, I prepare a lot of times because it is not very important to me to take, for example, SCE in this year, so I can post it in the next year and don't lose my money, because it is at a one trial. If you failed, you must apply in the next year by the same fees. Yes, collection of the guidelines, all collections are all available in the YouTube channel, and if anyone want PDF files, please send me a message and I can share it with you. And also I will upload this Zoom session in the YouTube channel. بس فعلا دكتور محمود انتم اول مجموعه الفيرتشوال ستادي نجحت بصراحه, كانت مجموعه رائعه يعني. هي المجموعه مش انا لوحدي, الدكتور محمود, دكتور خلدون, دكتوره نيره, دكتوره اسماء, مجموعه كبيره, الدكتوره رنا العراق, الدكتور ابراهيم العلي حبيبنا من سوريا الحبيبه, الدكتور خلدون, الدكتور سفيان ليبيا, مجموعه كبيره بصراحه. شكرا لكل الرسائل. انا صعب, بس لو اي حد يحب يسأل أنا معاه أونلاين. Okay, I will upload the presentation. هو مشكلة جروب الواتس is already full. There is no space for anyone for a WhatsApp group, but the Telegram is open for everyone. I can share the link and everyone can attach for it.
How long time will it take to at least the shortest duration time to clear
What?
the exam, sir? I mean, how long duration is needed to clear the exam?
As I mentioned previously, this is depends upon your background in the endocrine. If you have a sufficient background, 3 or 4 months is sufficient. If you don't have a practical background in the endocrinology, you need more and more time. So try to study Oxford Handbook. This is the only reference you want to study well.
Yes.
And after that, at least if you want to apply, please review the exam lab questions. If it is easy to answer these questions, so you can apply from the next month. If it is very difficult to you and memorize how to answer this question, please don't lose your money. European board, Dr. just Dr. Anoha Saleh, European board fees 750 euro.
50 euro.
And as I mentioned previously, European Society of Endocrinology gave a grant. I don't know this year it is available or not, but actually in the I already applied for the grant and received it. It reduce half of this fees.
Does it have any age limit?
What?
I mean, age limit like after 40 or after, that you cannot appear for the exam.
No. It is once you apply, you will do the exam in this year. If you failed, you need to do it in another year. دكتور محمود عزت حبيبي اكيد هيكون كان نفسي اسمع صوتك. فينك
حبيبي؟
فينك
قاعد بستمع والله.
لا
والله
ما ينفعش تسمع. انت ما ينفعش تسمع. انت ينفع تتكلم. ما ينفعش كده.
ايه اخبارك؟ وحشني والله العظيم.
انت اكتر والله. ربنا يبارك فيك.
والله جزاك الله خير يعني.
وعليه السلام. كلنا بصراحه بنعشقك يا دكتور محمود. يعني كل الناس الزملاء والانتر اكتف ديسكشن من غير الدكتور محمود ما تنفعش تبقى انتر اكتف. يعني انت على الاقل اللي بتشجع الناس انت والمجموعه كلها بصراحه. بس انت من الناس المشجعه. يعني اذكر في الفترات الاخيره الدكتوره روبان من الناس الانتر اكتف بتدخل وتتكلم وهكذا. المجموعات اللي فاتت طبعا كانت كلها رائعه بس بقياده الدكتور محمود عزت بصراحه.
ذكرتنا عليك والله. ربنا يخليك لنا دكتور خالد. والله الفضل الاول والاخير بعد ربنا.
لا مش ماليش فضل بصراحه. انتوا اصحاب المجهود الاكبر بالمناقشات بتاعتكم بمجهودكم والقصه دي بصراحه.
حبيبي يا رب. ربنا يبارك في اولادك ويبارك في عمرك ومالك وصحتك.
ربنا يبارك فيك يا دكتور. في حد من الزملاء بيسال في مكان في بغداد. اي ثينك في بس you can go to the website, this website, and they mention that available size, where the available size I think here. مشتاقين لك والله. صح يا دكتور محمود. انت والزملاء كلهم بصراحه يعني الواحد مفتقدهم. بس طبعا
يعني
كتر خيرك
يا باشا. ربنا يبارك فيك والله. ان شاء الله يبقى في حاجات كده مع بعض باذن الله.
بمشيئه الله. يكفينا نشوفك نسمع صوتك. exam centers, this is one. I think Iraq, there is a center in the Iraq. So Dr. Karim, there is a center in the Iraq. But actually these centers, if COVID is according to the situation in the next exam.
Sir, is there any age limit for appearing the exam?
No, I think no. I think for SCE and European board, I think no.
Okay.
The grant actually, Dr. Muhammad Riyad, I think if I go to the Endocrine Society, European Society of Endocrinology, I will go to the link, and this is one. Publications, I think education, European education. I will go to the European board examination. In this website, you will find that there is a grant or not. But actually, the grant, this is when ESC will award a limited number of grants. This is one. 50% of the examination fee for only ESC members, and for it is must be in the reduced rate category according to the WHO. And I actually, in my country, Egypt, it is a reduced rate category. So I can apply for this grant. Application for this grant will be open from the Friday, 98th January till Sunday, 14 February 20. So you have, I think you have, will be in the next. Just click for this and apply the data needed. You must be a member for European Society of Endocrinology, and this is a grant for reduced rate category countries only, or any training country or any training membership. And after that, they will send you an email message if the grant is accepted. And after you do the full fees, they will resend half of this fees after the exam, not before. So you will do the full fees and after the exam to be sure انك دخلت الامتحان. ما اعرفش الواتساب جروب فيه ولا لا، ما اعرفش. على اساس ان الناس اللي بتجهز الامتحان والقصه دي في يعني ممكن مجموعه تعمل واتساب جروب عادي، لو حبوا يضيفوني ما فيش مشكله يضيفوا، يعني ما فيش اي مشكله في القصه. What do we need to work with European board in the Europe? I don't know. Is it beneficial in the Europe or not? I think it is beneficial. At least for me, I study European board and SCE to just learn more and more about endocrine. الأوراق المطلوبة الرفع في الموقع للقبول في دخول الامتحان. I think there is no requirement. Just if you go to this one, you will find that this one exam, how to apply. I think there is no requirement. Image in question. This is the image in the question. MRCB is the feedback received from candidates who take examinations. This response survey, a lot of comments left in the response to the question survey about the quality of image. It is a good quality. And how I think there is endocrine. Apply. How to apply. I think in this page you will find that a requirement to enter the exam. I think there is no any requirement. Actually, there is no any material to upload it to the center. انا مش عارف في اسئله تانية، انا ربما تكون اسئله تانية اتحطت ما انتبهتلهاش، ما اعرفش بصراحه، بس لو في حد معاه سؤال يساله انا معاه، لان صعب الكلام كتير بصراحه، صعب جدا ان ايه.
لسه نسيت الشيء اصلا.
PDF file in the Telegram. If you go to the Telegram, I will go to the Telegram. This group, this is our group, and go to the files here. These files, you will find 76 files. This is a Telegram, our Telegram group. All questions or material are already presented in this Telegram group actually, and also in the WhatsApp group the same. So SCE and European board in the endocrinology, and you will find, go to the file this one, and you will find all the PDF material. أنا من ليبيا وأسأل أقرب مكان لينا. في الغالب I don't know it is presented in the Libya or not, but if you go to the MRCB UK you will find all the information, and all the centers are available for this exam. the centers, you will find that centers available here in this website. Dr. Chevan, which is better recognized as specialty SCE or European board? If you have MRCP in internal medicine, I recommend SCE. If you don't have MRCP, if you want to go to the UK, so SCE is the best. If you don't want to go to the UK, then the European board is better because the fees is less. Both are the same exam, but the European board is less cost.
ممكن اقلب بقى ولا نقلب حاضر الريموت يلا
Alive, شكرا يعني I think all the questions are answered, and I think my this one. Is the preparation for SC sufficient for Arabic board? I think the SC and European board curriculum is very enough to any endocrine studying in Arabic endocrine studying. So it is a very comprehensive and big curriculum. So I think it is very beneficial for every one interested in endocrinology. طبعا الشكر لكل المجموعه في الدكتور سامح لخصهم، دكتور محمود، ابراهيم، سفيان، رنا، خلدون، نيره، وما ننساش المجموعه كلها بصراحه اللي شاركتنا في الجلسات والمشاركات بالاسئله وكده. This is the sources for SCE. This is the summary. Oxford Handbook is the best one. Best of 5 Atoll book, study BRN, exam lab, SCE and European Board website questions, breach of medical journal examination SCE, practical diabetes with guidelines, which is GBDS, nice. Some of European Society of Endocrinology and Endocrine Society and ETA, and as Dr. Ala said, the American guidelines for thyroid is very important. I think the most important in the American thyrotoxicosis, thyroid with pregnancy. This is a very important guidelines, and thyroid cancer, because the American guidelines published, the American Thyroid Association guidelines about thyroid nodule in 2015, and another one for children, thyroid nodule in children, and another one for medullary thyroid carcinoma. So I think thyroid cancer in the American guidelines is very big enough to study with. Thank you everyone. سامحوني لو في حد سأل سؤال وما جاوبتوش لأن أنا ما انتبهتش لكل الأسئلة. Genomics, or no need to focus on it, don't look for it. Just the mode of inheritance of some disorder is very important. For example, and I think already we discussed inherited endocrine disorder, because this chapter is very important. Inherited endocrine disorder, this chapter is very important, and I already highlight the Oxford Handbook, the most important topics in the book, and already if you search, this topic is very important. If you search from our endocrine group about inherited, this you will find that there is in disorder. I think this file, if you search for inherited I want to check inherited. This is one.
There is a complete separate presentation on this
Dr.
topic.
Roban, how are you?
Assalamualaikum, Dr.
Nice
Khalid.
to see
Yeah,
you,
Alhamdulillah.
actually.
Alhamdulillah, I'm fine.
And this file is very important. Inherited endocrine syndromes is very important because it summarizes this chapter. How are you, Dr. Ruben? And how is Zuhran?
Yeah, Alhamdulillah. Zoran is with me. Yeah, just now he heard your voice and now he came running to me to see you on the screen.
Nice to see you.
Thank you, Dr. Khalid. Thank you.
إن شاء الله أشوفكم على خير. أشوف لو في حد. شكرا دكتور ريم. شكرا دكتورة صباح. شكرا. What is the topics covered under others? What are the topics covered under others? This is appetite, obesity, dyslipidemia, neuroendocrine disorders, for example, inherited endocrine disorders. This is others topics actually. But for example, primary hyperparathyroidism, you will find it in the inherited endocrine disorder. This is with parathyroid, but other types, for example, Kearney complex, POM syndrome, Cowden syndrome. This is others topics. There is no significant classification for the types of question. Some questions may be from thyroid and pituitary in the same question, and so on. So the numbers applied in the exam is approximately numbers.
Thank you very much.
Dr. Khalid, do we have some questions on the metabolic disorders in the real exam?
Actually, in my previous 2 years in SCE and European board, I don't remember enough. But if Dr. Ala is with us, if she have an answer about this question, the metabolic question, but I think if there is a question like this, 1 question from 200, so it is not very important to lose your time to study these topics actually.
Thank you very much, Dr. Khalid. My questions, from your experience, from where it start, from Oxford Handbook or from on examinations, questions, or from BRN study?
I think the most practical method, the first one, is to study 1 chapter from Oxford Handbook. For example, I will study this Oxford Handbook, the first chapter, thyroid, not first chapter, all chapter, just, for example, anatomy, physiology, molecular testing, and after that, try to solve some question from this chapter. If you don't know, if you go to the, for example, on exam, if you already have an account on exam, search for thyroid questions and try to solve some questions like this, and then go to the next part from the thyroid till finishing the thyroid. After finishing the thyroid chapter from the Oxford Handbook, and highlight the most important words and things, and if you can write some your notes, go to the Atoll book and solve thyroid questions, and go to the examination questions, go to the study parenting questions on the thyroid. After that, go to the next chapter, for example, pituitary, and so on. If you have a sufficient time, if you haven't a sufficient time, try to solve a question from the pituitary during studying the thyroid portion, and after studying thyroid, solve thyroid and adrenal questions, and so on. I think if you want to prepare well, study a portion from the Oxford and then solving question about this one. And of course, if you, for example, study read amiodarone in the Thyroid Oxford Handbook, you can review the European Thyroid Association guidelines for amiodarone-induced thyroid disorders, for example. If you study hypoglycemia, you can go to the Endocrine Society guidelines for hypoglycemia disorder in adults, and so on. This is very important to mix the guidelines with the Oxford Handbook and the questions.
Thank you. Thank you.
One asked about what's the approximate number of questions to be answered correctly out of 200 to pass the exam. Actually, this is we have no accurate answer for this question, but in previously 60% is sufficient to pass. But in the previous marking system, they changed the mark how they mark the answers. For example, some questions may have a 5 points, and some questions have a 1 point according to the difficulty of questions. So no one can answer this question, but I think 60% of the questions is sufficient to pass, especially if include difficult questions. Actually, in the exams, there is about 10 questions. It's very easy questions. Anyone can answer them. And in some situations, these questions is not included in the marks. For example, in my year, we have answered 200 questions, but in the I will show this my certificate. Actually, they put this in the European port. I think one of واحدة منهم. This is one. This is mark. This one. Here they ask your score. This is not total number of questions, not for this. I actually in the SCE. This is one. If you see this score, examination result, your score, a total number of questions 194. But actually we answered 200 questions. So 6 questions are removed because they may be easy enough. Everyone can start. I don't know. But this is for SCE, the pass mark was 118, which resemble about 60%. Thanks for everyone. أنا مبسوط كتير إني شفتكم، مبسوط كتير إني سمعت صوت الدكتور محمود عزت، دكتورة روبان and other members. And if anyone has a question, it is welcome. And this is the last. This is my what's number 011 1839112. This is my what's number from Egypt. If anyone want any material, it is welcome. And if anyone want any question, also it is welcome. Thanks for everyone.
Thank you, Dr. Khalid. Thank you.
See you later إن شاء
جزاك الله خير. جزاك الله خير دكتور.
أشوفكم.
دكتور
السلام عليكم.